Sonia present, please read.
Yes. The results of a separate diagnostic curettage of mucus of uterus, cervix, and body made up in connection with bleeding in a postmenopausal period. The scrape of the mucus of cervical canal revealed no pathology. In endometrium, there is highly differentiated adenocarcinoma. Metastases are not found. What method of treatment is most correct? Surgical treatment and hormonotherapy because it's adenocarcinoma.
Hormonotherapy. Here chemotherapy. Here you need to only remember, guys, maybe different variants. Chemotherapy also can be possible, but in this case it is according to the TNM classification and according to the rules of oncology. Only you need to remember this. Number second, Navjot,
A 43-year-old woman complained of contact hemorrhages during the last 6 months. By manual examination, cervix of the uterus is enlarged, its mobility is reduced. Mirrors show the following: cervix of the uterus is in the form of cauliflower. Shorobach and Schiller tests are positive. What are the most probable diagnosis? Cancer of cervix of the uterus.
Yes, why it is not polyp, why it is not cervical pregnancy, nothing fibroid, or
That
leukoplakia.
Shorobach and Schiller test usually for to detect the cancer of cervix.
Yes, who can tell me, guys, or maybe you know, my dear, Hrobak test. What does it mean, Hrobak test?
Iodine, teacher, iodine test.
No, my dear, Schiller test. It is iodine. Yes, positive, present white spots on the cervix. Yes, but Hrobak, with the help of the probe, it is metallic probe. Yes, doctor touch the area of lesion and appear bleeding. Because if it is cancer, guys, the tissues is very fragile. And if we touch with the instrument or with our finger, begin bleeding. It means Hrobak test, guys. Remember about it. Schiller, it is iodine solution. Probe with iodine solution. We cover the surface of the cervix by iodine solution. We name, in most of cases, it is Lugol. And we see the white spot. It is the lesions on the cervix from which we need to take biopsy. And you see the sign. If it is cauliflower, in most of cases, it is cancer of the cervix. Yes, and pay attention to the complaints of the woman. It is contact hemorrhages during last 6 months. Yes, it is also evident signs of maybe cancer. The next, please. Kaushal present or not? Shanil absent. Yes. Then Khan, please read the test. Khan absent or present?
51-year-old patient complained for having intensive bloody discharge from vagina for 15 days after delay of menstruation for 2.5 months, in anorexia disorder of menstrual function during a year. At the same time, she felt extreme irritability and had sleep disorders. Ultrasound examination results uterus correspond with age norms. Appendages have no peculiarities. Endometrium is 4.4 mm thick. What is doctor's tactic? Diagnosis of uterine cavity.
Yes, give me argumentation on this diagnosis. Why we don't indicate it?
The menstruation delay in menstruation here.
Yeah.
There's like endometrium is very thick, like.
Yes, you're quite right. It may be, what can be this? It cannot be what? Hyperplasia.
Hormonal effect.
Hyperplasia, but it also may be the beginning of the cancer. Yes, but in order to set this diagnosis, you see, guys, the age of the woman, 51 years. Так, Sureshki, 51 years old. Yes. Then she has bloody discharges and delay of menstruation. Yes, and plus irritability, extreme irritability, sleep disorders. It is the signs of climacteric syndrome. Yes, but she has hyperplasia. It may be hyperplasia of endometrium, but maybe cancer. And I want to tell more. If we don't remove this thick endometrium and don't perform curettage, she can bleed in for a long time, half a year, if she don't visit a doctor. That's why we, at the same time, we treat this woman and perform histological investigation. That's why diagnostic curettage of the uterine cavity. As soon as possible, it is hyperplasia because there is no pause here. Climacteric pause, yes, stop of menstruation. She has only delay. It can happen in periclimacteric period. And of course, remember diagnostic curettage of the uterine cavity in any case, especially if the woman with bleeding in this age. The next, number 4. Mandip Singh present.
Yes, teacher.
Read, please.
Laparotomy was performed to a 54-year-old woman on account of big formation in pelvis that turns out to be one-sided ovarian tumor along with considerable omental metastasis. The most appropriate intraoperative tactics involves ablation of omentum and uterus and both ovaries with tubes.
Yes, guys, no, here what we have, it is Viragov operation about which I told you. Yes, ablation, they mean resection of omentum, removal of omentum. Yes, no, here picture evident, don't, no, biopsy of omentum is not enough. Yes, intraoperative tactic, we need to perform operation, they mean. Yes, that's why she has tumor. She has metastatic to omentum. Of course, 54 years old, age also we take in account. Yes, and that's why, of course, we remove omentum because omental metastasis uterus and both ovaries with fallopian tubes. Yes, here we perform total hysterectomy together with resection of the omentum. Of course, here, no, yes, and this question you see here, endometrial adenocarcinoma, guys. Do you remember endometrial cancer? And I told you that in any crop present one question which devoted to TNM classification, and Mandip Singh answered me. Yes, number. Please, Milimba, read the test. Milimba present? Hinda, I wait for you. Maybe don't. Yeah, Milimba need to be present. Hinda, Milimba, my dear, where is you? No, we cannot wait, guys. Так, Маханти, Ашит present? Маханти, read please. Milimba, we will wait. Every time I wait. Так, Маханти, please read the test. Yes. Yes, uterus with serosa. Yes, extending to serosa, it is 3A stage. And that's why, guys, I don't know, maybe, TNM classification in general, you need to remember. For example, I recommended you to look for cervical cancer, cancer of the uterus, and endometrial. Ovaries, I never meet, but they can change, and this one question can be solved the result of your crop. That's why it is as you wish to learn these classifications or no, but maybe it is necessary. Number 7. Так, Milimba absent, I put, yes. Так, Natalia present, Eutemi. Eutemi absent, yes.
Teacher, I'm present.
Present, please read the. Eutemia, hello.
No, teacher, this is Shindo. You said you put me absent, but I'm present.
Vilimbai, Hinda, please read the test.
Number 7.
Number 7, yeah.
Okay. 48-year-old patient complains about contact hemorrhage. Speculum examination reveals hypertrophy of uterus cervix. It resembles of cauliflower. It is dense and can be easily injured. By manual examination revealed that fornixes was shortened. Uterine body was non-mobile. What is the probable diagnosis? So it is a cervical carcinoma because of the cauliflower of the
guys, yes, no, here a lot of, they gives you a lot of signs. Yes, of course it is cauliflower. Yes, then easily injured. Yes, when touch may be bleeding. Fragile tissues. It is Chrobak test. Chrobak, remember. Then examination revealed fornixes shortened and uterine bodies was mobile, non-mobile. Yes, immobilization of the organ. It gives metastatic process. Yes, affected not only cervix we see here, but uterus as well. Yes, and if we have shortened of the fornixes, yes, flat fornix, not short, flat fornixes, yes, any mass there, it is what? Maybe spreading to intracellular tissues which occupy the tissues around the uterus. Yes, and of course, all begin from cervical carcinoma. We have here, it can be fibroma, metrofibroма, I never saw this, fibroma, yes, fibroid in your books maybe. It's maybe endometriosis, you know, no, here we have cauliflower, never, if it is endometriosis, we have cauliflower, then it's maybe cervical pregnancy, but we have other signs. I told you about the signs of cervical pregnancy. Cyanotic, asymmetric localization of the external cervical os, bowl-shaped form of the cervix. Then cervical papillomatosis, usually we can see the small warts on the surface of the cervix. That's why only, and you are quite right, first of all, it is cauliflower, and it is the sign of the cancer. Так, Milima, thank you. Так, Eutemia. Are you here? Eutemia, no. Eutemia absent, yes. Так, need he please read the test? Need he present? Need to be. Need he.
59-year-old female patient applied to a maternity welfare clinic and complained about bloody discharges from the genital tracts. Postmenopause is 12 years. Vaginal examination revealed that external genitalia, genital organs had signs of age involution. Uterus cervix was not erosive. Small amount of bloody discharges came from the cervical canal. Uterus was of normal size. Uterine appendages were unpalpable. Fornices were deep and painless. What method should be applied for the diagnosis specification? Separated diagnostic curettage, because
Yes,
it's already
give me argumentation. Yes, what has this woman? What severe symptom?
Ma'am, there's bloody discharge after postmenopause.
Yes. But and pay attention. Usually, this woman has normal size of the uterus, unpalpable appendages, but severe symptom. It is, you're quite right. It is bleeding after. You see, 12 years it was the pause. Of course, it is one of the signs of malignization. First of all, they think about the malignization. I want to say, guys, maybe bleeding. Not ever it is cancer. It's maybe in diabetic woman. Yes, because they have fragile vessels. It's maybe if it is hypertonic crisis, yes, maybe diseases of blood with the decrease of coagulation. But first of all, we think about malignization. If we set the diagnosis further, we can see what we need to treat. But first of all, we need to exclude cancer. That's why, of course, it is separated or a fractional diagnostic curettage. of the uterine cavity. Thank you. The next, please. Так, it was need here. Yamin, please read the test.
After examination, a 46-year-old patient was diagnosed with left breast cancer, T2N2M0, clinical group 2A. What will be the treatment plan for this patient? Radiation therapy plus operation plus chemotherapy.
Plus chemotherapy, guys.
Yeah.
No, you need to know every
Please,
breast
but
cancer.
this is not metastatic, right? So
Yes, guys. And no, again, I pay your attention. Maybe such provoke questions. They're difficult. It's difficult to remember this classification and management, which correspond to every stage. But we need to know this. You know, here, if you have this test, more long sentence. Yes. Radiation therapy, if it is late stages of the cancer, chemotherapy, also it is the late stages of the cancer. And if there is no metastasis, we try to treat in this way. Number 10, please, Preeti, read the test.
68-year-old patient consulted a doctor about a tumor in her left breast. Objectively, in the upper internal quadrant of the left breast, there is a neoplasm up to 2.5 centimeter in diameter, dense, uneven, and painless on palpation. Regional lymph nodes are not enlarged. What is the diagnosis? It is cancer.
You are quite right. What are the signs of the cancer if you speak about the neoplasia of the breast?
It is painless, and normally cancer is unmovable.
Yes, unmovable, uneven, they have right for you. Yes, painless. Yes. And maybe sometimes they give you the metastatic process in axillary lymphs, but enlargement of the lymph nodes in axillary area may be the sign of inflammation as well. Yes. During pregnancy, it may be additional lobe of mammary gland. But here there is no sign, as you see, retracted nipple. Yes, do remember evident sign of cancer.
Yes.
But you are quite right. It is painless. It is usually cancer is dense. And there is no strict shape of the cancer. Every time we don't determine exactly the shape of the cancer. Yes, the form of the cancer, uneven and dense and painless. Yes, you are quite right. Thank you. Number так. And Suresh, please read the test.
A 26-year-old woman complains of having a bloody discharge from the genitals for the last 14 days, abdominal pain, general fatigability, weakness, weight loss, body temperature rise, chest pain, obstructed respiration. 5 weeks ago, she underwent induced abortion in the 6th to 7th week of gestation. Objectively, the patient is pale and inert. Bimanual examination revealed that the uterus was enlarged up to 8 to 9 weeks of gestation. In blood, HB is 72 gram per liter. Urine test for chorionic gonadotropin gave the positive result. What is the most likely diagnosis? It is choriono or epithelioma.
Epithelioma. What are the main signs from these options? Why you choose chorioepithelioma?
The urine test is given. Chorionic gonadotropin gave the positive result, and the uterus is enlarged up to 8 to 9 weeks of gestation.
Yes, guys, sometimes it's maybe hydrotidiphilum or malar pregnancy. It is benign transformation, but you have here usually hydrotidiphilum they give you if during pregnancy it happened. Here it happened after 5 weeks. Yes, more than 1 month. Yes, and what have which show us malignancy, fatigability, weakness, weight loss. Yes. That's why maybe together with chorioepithelioma present malar pregnancy. But malar usually during pregnancy. If it happened after pregnancy, usually it is complication. It is malignization. In this case, it is chorioepithelioma. And you are quite right that the evident bright sign, it is high level of gonadotropin. Yes. Так, guys, how many questions we have here? Так, 18 questions. Should we continue to read, guys?
Yes, teacher, we can.
Yes. No, let's try and again from так, Eutemia, not Epia, Eutemia. Eutemia and Kaushal absent. Yes. Так, no, absent, значит absent. No, again, my dear, I ask you to.
Teacher,
Who are you?
it's
Kaushal?
Chindo. No, it's Chindo.
What you want to ask me?
No, teacher, Euphemia's audio is not working.
What?
The audio for Euphemia, it is not working.
What do you mean, my dear?
Like she cannot access the like to speak.
It is for
Teacher, she's present, but she cannot switch on the.
Eutemia.
Yeah.
Very bad. She's here. No, I
Yes,
pointed.
but
I see
like
she's good student, but no, I understand, my dear. She was present on the first, but him no conditions to speak. Yes.
yeah, it's the device.
Something
the
wrong
device.
with internet. Yes.
The device. Yes.
Thank you, my dear. Yes. No, let's read Hunia, please. The test.
A 26-year-old woman complains of having bloody discharges from genitals for the past
Excuse me, we have read this test. The next, number 12, my dear.
A 58-year-old female patient came to the antenatal clinic with complaints of bloody light red discharges from genital tracts. Menopause is 12 years. Gynecological examination found externalia and vagina to have age involution. Uterine cervix was unchanged. There were scant bloody discharges from uterine cervix. Uterus was normal size. Appendages were not palpable. Perimetria was free. What is the most likely diagnosis? Uterine carcinoma, because she is postmenopausal.
Yes, guys, I want to say, of course, it is provoke question. How we can say it once according to the only symptoms that it is uterine carcinoma? No, we have atrophic colpitis, cannot be colpitis because blood discharges. Yes, it's maybe abnormalities of the menstrual cycles with climacteric characteristic, but menopause is so long, 12 years. Yes, and granulosa cell tumor of the ovary, we have no any changes of the ovary. And that's why we think, first of all, about the cancer of the uterus. Yes, they write here carcinoma, but maybe it's maybe cancer of the endometrium, but in any case, you need to choose what you have in the test. Yes, we have the blood discharges from the uterus after the menopause of 12 years. And you are quite right, it is the main sign of maybe malignization. Yes, you see here, pay attention, they confused you because the uterus has involution, small uterus, there is no changes of adnexa, only scant bloody discharges. I told you, it is the specificity of the cancer in old woman, of cancer of the uterus or endometrium. And no, we have no here any choice than to choose this uterine sarcoma, but not so good options, I want to see. Number 13, and please, Navjot Singh, read me.
54-year-old female patient consulted a doctor about bloody discharge from the genital tract after 2 years of amenorrhea. Ultrasound investigation and bimanual examination will know genital pathology. What is the tactics of choice? Fractional biopsy of lining of uterus and uterine mucous membrane.
No, again, fractional biopsy of lining of the uterus and uterine mucous membranes. It is the same.
Yes.
It is the same, or lining of the uterus or uterine mucous membranes, but we have what we have. Yes, stripic drugs, contracting drugs, estrogenic hemostasis, hysterectomy is so voluminous method of treatment. What we have here, what diagnosis, what we think about?
That lady has menopause, then again
Yeah.
bleeding, and
Yeah.
we can do like biopsy. We can check the cancer of uterus, maybe.
Yes, yes. Guys, bleeding, it was the pause, or maybe pay attention first of all to the age, then pause. Usually it is fractional curettage of the uterine cavity. I don't like this answer, but we have no other answer. Fractional biopsy or lining of the uterus. We have curettage, maybe histological investigation of the internal layer of the uterus. Yes, and it is right. I see that euthymia added to us. It is euthymia. Are you hear me? And if it is possible to read the test, my dear.
Yes, ma'am.
Oh, I'm very glad to hear you. Mhm.
A 54-year-old female patient consulted a gynecologist about bloody discharges from the vagina for 1 month. Last menstruation was 5 years ago. The gynecological examination revealed no pathological changes. What is the tactic of choice?
Mhm.
So it's a diagnostic fractional curettage of uterine cavity.
Yes, give me the augmentation of this answer. What woman has?
Bloody discharges from vagina. This could be it could be cancer.
Yes, but why it could be cancer? What happened? She
The
has
woman
bloody discharges. First
yes.
of all, age of the woman. Bloody
Yes.
discharges for 1 month, and last menstruation was when? 5 years ago. Yes, but certainly appear bloody discharges. Yes, it is one of the signs of the cancer. Yes, that's why in order to prove and or reject this diagnosis, we need to perform fractional curettage of the uterine cavity. I hope you remember curettage what? Of the separately cervical canal and then uterine cavity, yeah? Because we need to prove or reject this diagnosis. The next, number 15, and please, who, так, Khan maybe, or Khan have read, my dear, Khan. Khan?
Yes, teacher.
Read please the test.
A pregnant woman was delivered to gynecological unit with complaints of pain in the lower abdomen and insufficient bloody discharge from the genital tract for 3 hours. Last menstruation was 3 months ago. Vaginal examination showed that body of womb was in the 10th week of gestation. A fingertip could be inserted into external orifice of the uterus. Bloody discharge were insignificant. Ultrasound shows a small vesicle in uterine cavity. What is the most likely diagnosis? It's a hereditary pregnancy, Great Moon.
Yeah, why, my dears?
Because there's an opening of the external orifice of the uterus.
But what are them? But maybe it is risk of abortion. Maybe it is abortion which begin. What we have? Ultrasound showed small vesicles in the uterine cavity, guys. Yes, small vesicles in the uterine cavity. It is the main sign of hereditary malar pregnancy. We have only, guys, 9 minutes and 3 crook tests. And I ask you to read, Sin, please read the test.
28-year-old female patient complains of having hemorrhage from the genital tract for 1 month. 6 months ago, she had natural delivery and gave birth to a girl. Weight 3100 grams. Objectively, the uterus is enlarged to 9 to 10 weeks. Mobile, painless, of heterogeneous consistency. And examination reveals vaginal cyanosis, anemia, and body temperature rise up to 37.8 degree. There is significant increase in HCG concentration in the urine. What is the provisional diagnosis? Uterine chorionoepitheliomatosis.
But I want to ask you why it is not high GTD4 mole. Also, we have
Because
increased.
she gave birth to a girl. She's not pregnant, and
Yes,
there is
yes. Guys, if we speak about the malignization, we have a history of birth. Yes, it was the malar pregnancy or birth. Yes, a history. In this case, we speak about the complication, malignization. If it happened at first, it is hereditary more. But she has pregnancy, she has labor, and only after this begin development of this chorioepithelioma. Yes, that's why, guys, be very attentive if you read the test about the trophoblastic disease. Both these conditions, it is trophoblastic disease. The next, thank you. Так, Milimba, can you read? Guys, Milimba present?
Yes, teacher, yes.
Read, please. Read, and again, the test about which I told you during our discussion of presentation. Please read the test.
A 50-year-old female patient complains of aching pain in lower abdomen. She has a history of normal menstrual cycle. At the age of 40, the patient underwent a surgery for gastric ulcer. Examination findings: abdomen is soft in the hypogastrium. There is well-defined nodular tumor of limited mobility. Vaginal examination finding: the cervix is clean, of cylindrical shape. Body of the uterus cannot be palpated separately. On both sides of the uterus, palpation reveals tight tumors with an uneven surface. The tumors are immobile and fill the whole pelvic cavity. What is the most likely diagnosis? So it's the Kuchenberg tumor, which is malignant of the ovaries because of the metastasis of primary site. And because classically there is also gastrointestinal tract involvement.
Yes, guys, they gives you in the history surgery for gastric ulcer, but this ulcer can be malignization of this ulcer. Yes, that's why we have a link between the cancer of the ovaries and cancer of the, but they hide the diagnosis here. They told you about the ulcer, but you need to think that it is Kuchenberg ovarian fibroid benign tumor, ovarian granulosa cell tumor. It is also benign, and they don't give us the such transformation. Tumor occupy all cavity of the pelvis. Yes, both sides tumor during palpation. Yes, then you see here we have here conglomerate uterus connected with this ovaries. It's immobile conglomerate of tissues. Yes, it cannot be benign tumor. This clinical picture. But they don't give you cancer of the ovaries. It is the cancer we have here of the ovaries. Yes, you're quite right to tell me. But Kuchenberg tumor, it is primarily cancer of the stomach, which may be developed from this ulcer. Patient was surgery, but maybe it is transformation of this ulcer to the cancer. That's why if you see in test any gastric pathology, you and the changes of gonads, yes, no, first of all, ovaries, yes, you think about the Kuchenberg tumor, and I remind you about this test. And the last one, guys, read please. We have 4 minutes, and it is enough time for. Так, Mahanti have read the test, yes. Так, Natalia, Nidhi, please read the last one.
A 48-year-old female has been admitted to the gynecology department for pain in the lower right abdomen and low back pain, constipations. By manual examination findings, the uterus is immobile. The size of a 10-week pregnancy has uneven surface. Aspirate from the uterine cavity contains atypical cells. What diagnosis can be made? Hysterocarcinoma.
Hysterocarcinoma with metastatic process we have here. Yes, pain in the lower back, constipation, and maybe the penetration into the rectum. Yes, increase of the size maybe of the uterus, and aspiration gives us a typical cells. Yes, aspiration from the uterine cavity. No, hysterocarcinoma, again, they at once set this diagnosis. They don't give us the histological characteristic of these cells, but cervical cancer cannot be. We have increase of the size of the uterus. Benign tumor of the uterus cannot be. Colon cancer, no, because we have changes of the uterus. Yes, and chorioepithelioma, we have no any signs of chorioepithelioma. They don't give an increase of the level of chorionic gonadotropin. That's why they think about, first of all, the cancer of the uterine body. No, it's maybe hysterocarcinoma, guys. Now, we finish our classes. We have only 2 minutes of our conference. Guys, thank you for participation. Thank you for attention. I wish you